Hi, YouTube world. I just wanted to update everyone that follows me or comes across my video on how I'm doing with my radial nerve palsy, which is also called drop wrist. And let everyone know that the three things that my massage therapist actually helped me with a lot more than my physical therapist. The massage therapist I actually decided to go to on my own. It wasn't recommended or suggested by the surgeon, which is kind of frustrating because she helped me a lot more in a week or two than the physical therapist did in the 2 months that I went. Um, for one thing, I've been actually kind of thinking about getting a compression glove, which is what this is. I have short fingers, so it's long. But to help keep the swelling down, it's been 3 months since all my surgeries. If you can't really see the scar because it's hard for me to twist, but I have an incision here and a long one here where I have plates and screws. And you can watch some of my other videos on all of that. But you would think after a couple months of my hand still being swollen that they would think of something besides suggesting I get nerve blocks. So anyway, when I went to the massage therapist, which is somebody I know, I asked her about a compression glove and she agreed that yes, that would be a good thing. So I actually went, and I know y'all probably think I shop at Walgreens all the time. It's just the Walgreens brand. They're called arthritis gloves, but mild compression. That's the only ones I had, so I just grabbed them. But it's really good compression. In fact, when I take it off, you can see like where the seams were. But it feels really good to wear, and does help keep the swelling down. So see, you can see where the seams were. I still can't really move my wrist a whole lot, so I'm still limited. Like I said, it's been 3 months. Um, so I need to consciously be thinking about pulling my wrist up. And this is still all the movement that I can do. And that's because my massage therapist, I've been going to her only a couple of weeks, but twice a week. And she's breaking up all the scar tissue in here because there's another plate and screws. And you can feel there's just a lot in there. And of course, the swelling. So no wonder I didn't really want to do physical therapy at home every 2 to 3 hours, because if it wouldn't move, it's kind of felt pointless. So I only did it maybe once or twice a day. And then actually I'm going to a new physical therapist, and she gave me some suggestions of, instead of working against gravity, to have my hand sideways like on a table and move it backwards. Because then, like I said, you're not moving against gravity. So it actually moves a lot easier. And I know I do need to work on the muscle because I did have the cast, and so these muscles are atrophied, and um, I can actually move my fingers a lot better. I can spread them apart. Can move my thumb. I know it doesn't look like much, but if you saw me a couple months ago, even 3 months, well, of course, 3 months ago, but if you saw me 2 months ago, you could see that's a big improvement. I can actually touch my thumb to my finger, not all of them, but it is a big improvement. Same with the elbow, and look at all the skin, flabby, gross. Anyway, so like the massage, she is like working all this stuff out, the lymph system, and it's very painful because she's not gentle like I just was. And she works on the fingers, and she bends the fingertips and the knuckle. But I'm more hopeful with this new physical therapist that's been at it for a long time on just the different exercises she gave me, which were way different than what the other lady therapist gave me, which was in a whole different office. Um, and she was also saying that we didn't need to be so aggressive because the other therapist gave me these straps that attached to a Velcro wristband that to hold my fingers down and to do it as tight as I could. And it was like very painful. Well, of course, I couldn't have it in that position for very long because it was very painful. And then especially when you take them off, like to open your fingers, oh, it hurt. And the therapist I'm going to now, she said she actually rather me not do it as hard as I can, to do it a little bit lighter, but then I can hold the stretch longer, and instead of having my body fight against the pain. So I thought that made sense, and was a bit of a relief. So the other thing my massage therapist told me was to get some putty. Um, and we only have like one medical supply store, and I knew it would be super expensive if they even had it. So I just went to a fun little toy store that we have here in my town. But you can find these online actually for probably a third of the price. It was pricey, but um, just so I could start doing it right away. So I've got this Crazy Aaron's Thinking Putty. They have so many different colors, and not that it really matters, but it's just kind of fun actually. This is what it looks like. Not all of it's glitter, I don't think, but and it looks like it's super hard in there, but it's not. It's like rubbery, so it doesn't dry out. And I I would suggest if you get this or something else, this is I think 3.2 ounce size, because they make smaller sizes. But just so you have enough, if you don't have a big range of motion, um, to squeeze it. But what the massage therapist was talking about is working on just any of it, just twisting and pulling. So this has some good resistance to it. And it's actually something, if it's laying around, I'll think about just grabbing. It's kind of like, something fidgety to do. That's also therapy. So I know I'm using my good hand a lot. I have to remind myself, no, you got to use this other one to pull with. But so anyway, I got that just right away so I could start. And I think that has helped me improve. But then I did go ahead and order, which I found these on Groupon, but you could probably find them anywhere online. And this actually has 4 different type, and it's hand therapy putty. Like I said, I found it recently on Groupon, but so it might not be there when you look. But it's this one came with different uh, resistance. That's the word. So there's soft. I think this one's, extra soft. I don't know why they're different colors, but just so you can keep them apart, I guess. Medium. And then this one is supposedly harder, but really they kind of felt like all the same to me, but maybe they're different. I don't know. And these probably don't dry out either. The only thing is it's not very much. It's a very small amount. So for me, because I don't have a big range of motion, I don't really use this too much yet. I've tried it a little bit, but because I can't close my hand very much, I'm going to wait on those. So that is that. And I'm just kind of frustrated because the other physical therapist, the first one that I went to, I actually asked her, I said, what about like a stress ball? Which actually, now that I think of it, like a racquetball would be kind of cool, just something to grip. And she said the reason she didn't like that is because I wouldn't get full range of motion as far as like, bending the fingertips, which I can understand. But also, as long as I'm grabbing something and trying to move my hands and my fingers and even my wrist, to me, that's better than nothing. I hate those straps. And the other thing that the massage therapist did that I wish the physical therapist would have done is she has the tens, so that it's a little pen and it sends little shocks. So it's kind of like testing my nerves. And when she does it on my thumb, it involuntary twitches. And she said when she goes up around here, it doesn't really jump. So she's thinking that all the nerves aren't really firing 100% yet, which I knew was going to happen because the surgeon said my injury could take 3 to 6 months for the nerve to heal. So that's why I don't understand why he was so kind of freaked out at 2 months saying, oh, you should be able to make a fist and you should be able to turn your wrist and do all this stuff. And you've got to go push yourself really, he was like bending my finger like so hard. I was about in tears in the office, and he was like, that's how hard you should even going harder than that. And then, like I said, he suggested nerve blocks. Well, for me, it seems risky. I don't know. Maybe it's not. The problem is I can't really just call up and ask questions. You have to go to consultation. Well, I don't have insurance, so it's all out of pocket for me to pay. And I don't know if there's risks of can nerve blocks damage nerves. I don't know. Maybe it can't. Maybe I'm worrying over nothing. But I guess it's not just like one shot. They do shots in all the little nerve places, and just like I don't want all that. Plus, it's from what I've read, it doesn't even last very long. So we're talking thousands of dollars out of pocket for it to last 12 to 24 hours, maybe. I don't know. Like I said, I don't have answers because I can't just ask them questions without going to a consultation. Well, if I decide not to do it, that's kind of money down the drain. And I and then the physical therapist said, well, yeah, after you get that done, you need to come in right away so we can move you. But then it sounded like, well, you might not have an appointment, but you can come in and, just work on, we can give you something to do. But if they're not going to like really, really move me hard because of the nerve blocks, like I said, it would just seem like a whole complete waste of money and time and worry and risk. But supposedly it would help with blood flow, which I don't understand that either. I don't know. I didn't really ask the surgeon why, how that would help with the blood flow. But that's why another reason I decided to do the medical massage, because I mean that's going to help with blood flow, and she does a very good job. It's At first I did an hour, 2 times. That was a long, painful hour. Now I just do half an hour twice a week. And I'm not as sore afterwards. It's still very painful during. But I know it needs to be done. I mean, I've got to heal. I can't take a year. I mean, I could, but why would I want to? So anyway, those are the ways that my medical massage therapist helped me out better than my physical therapist. So just an idea. I mean, don't do anything without asking your doctor or surgeon. I'm by all means not an expert. I've just been going through this for 3 months since I injured myself in November, and it's now February. And my surgery was like 4 days after I hurt myself. Both my surgeries, they were at the same time. So I'm hoping in a couple months I'll be way further along and can show you that progress. Meanwhile, if anyone has any more suggestions on things to try, my new physical therapist also told me that I am going to have to kind of retrain my brain because my brain knows that this is all injured. And of course, I'm always kind of doing this, which that plus the sling has caused me to have frozen shoulder. So now I have shoulder problems where I don't have full range of motion on my shoulder. It's very painful. It just feels like it's stuck, like it just won't move past there. And it might just be all in my brain because of it hurts, so I won't move it. But it just feels like if I go past here, it's going to break or something. And it's, I'm sure it won't, but that hinders a lot of things I do. But I need to start learning to just like try to pick things up with this hand. You know, every once in a while I try to turn a doorknob. Luckily I have one of those, you know, the long handles that you just push down. So I've been doing that to get my hand moving. But yeah, there's no way I can turn a doorknob when I can just barely even twist my wrist around. Anyway, this video is long enough. Sorry about that. Hope everyone's well. Peace.